she's she is shadowing for this. Yes, China is shadowing. All right, hello. My name is Dr. Zanaya Zersi. This is my patient, Leilani Marie. She is coming in today for lip fillers.
Mhm.
All right. So, what I'm going to do, as always, I'm just going to ask a few medical questions to make sure that you're all set and ready, okay?
Okay.
All right. All right. Do you have any known allergies?
No.
All right. Do you take any medications currently?
No.
All right. Do you have any history of past surgeries?
Yes, I've gotten a lift. Yeah, I've gotten a BBL and I've gotten lipo
Okay. All right.
and a breast reduction.
Okay. Documenting that. Now, while I'm documenting all this, what Jimmy's gonna do, he's just gonna get your vitals to make sure that you're all good.
Okay, all vitals are within a normal, healthy range.
Okay, all right. So what I'm gonna do right now, I'm just gonna explain the procedure. So what I do is I just get some needles. It's gonna be thin. It's not gonna be injected all the way inside you. Just only about the tip, maybe a little bit above the tip or more. In the needles is filled with some collagen. I'm just gonna give you 5 cc's over your lips that seem to be a little bit thin in certain areas. So I would inject it like at least 1, 2, maybe 3 times, depending on how thin the area is. And yeah, and I'll just go over the aftercare instructions and stuff like that with you afterwards. But right now, I'm just gonna see your face a little bit. So I'm just gonna put my gloves on and just touch around your lip area. I ain't never think I'm gonna have these lip filler macros to be pushed up a bit more. Cause I ain't think everybody might want lip fillers. All right, so I do see your top lip and your bottom lip needs to be a little bit filled up so it could be a bit even. It seems like both areas on the side, on the left and right side, are a bit thin, but your middle is a bit plump. And then your bottom lip is thin. So we definitely gotta
Okay.
inject at least 4 to 5 on your bottom lip. All right, so I'm just going to use my handy dandy pencil and I am just going to mark your upper and bottom lips. You're just going to feel like a little faint little blop, blop, blop on the lines and stuff like that. So I can see where I have to inject them at. All right, you're all set. Oh, wait. Okay, now you're all set. All right, perfect. I gotta fix these macros, but I do that another time.
Oh, perfect.
right, I'm going to go ahead and hit your top lip. I'm just going to tilt your head a little bit up. And I'm just going to feel your sides. You're going to get 3 sides on each side. You're going to feel a small little pinch. So I'm doing the first one. Boom. Going over. Bam. To the second. And to the third. All right. Now I'm going to go over to your other side. And I'm going to feel the other side as well. Just 3 shots. Upper lip, your 3 shots. So like I say, you can feel a little prick. 1, prick 2, and prick 3. All right, perfect. So you won't see a little bit of blood. No worries, I'm gonna get alcohol wipe and clear that out. Because we can't. I'm sorry if it hurt. I'm so sorry. Like I said, it's just a quick little prick, nothing more. Just gonna lightly wipe away the blood. And now what I'm going to do is I'm going to go ahead and inject to your bottom lip. Now your bottom lip is the one where you can get a lot of work on because it's about to be like 5 shots all across your bottom lip because it's so thin. So right now, get prepared. I'm going to go ahead and get my other needle. This one has more collagen due to the fact that your bottom lip, you still get 5 cc's. It's just this needs a bit more filled up. I got it filled up to 50 cc's because we finna put a lot in you. Well, not a lot, just 5 cc's. Okay. All right, starting right now at your bottom on your right side, I'm just gonna go on ahead and inject over on your right side. So I'm gonna do this pretty rapidly so you won't feel too much. So here's 1, 2, 3, 4, 5. And I'm gonna go over to your left side. 1, 2, 3, 4, 5. All right, so the hard part is over. No more pain, hopefully. And I'm just going ahead and just lightly tap on it so make sure it's a bit good. Right now, just want to make sure I'm just basically shaping your lips out. So right now I'm at your bottom, just shaping your lips out. And then I'm going to work my way to the top just to shape them out a little bit to make them nice and plump. All right, so you are all finished.
Great.
You're welcome. So just a little bit of your aftercare instructions. So when you have lip fillers, make sure you are very careful on what you're sipping and eating on because you do not want any food inside of those holes, those puncture spots, because if you do, you might get a little bit of a lip infection. You have to come back in here. If you're still experiencing some pain or some more bleeding, please come back. Within the next 24 hours, please come back. In the next 48 hours, if your lips are swollen, red, and itchy, please come back. It could be a sign that you are allergic to the collagen. And also, we are going to give you a lip balm. Your lips going to need to stay moisturized basically all the time. So our lip balm is going to give you the moisturization, and also it's going to help prevent. It's also going to help prevent any scarring with those injecting spots. Other than that, do you have any comments, questions, concerns, emotional outbursts?
The only question I had is, should I be drinking anything like hot, or should I just try to stick to cold or lukewarm drinks?
So I recommend not to drink anything hot. Try to drink something cold, like maybe smoothies or iced coffee, something like that. Some water, definitely, because water is water. It's not going to do too much. Sip through a straw if possible. Actually, yes, sip through a straw. Totally sip through a straw because It's better. It help you prevent the drinks coming inside of your lips at the puncture spot. So please try to avoid anything that's hot, and try to sip through a straw if possible. If not, just try to waterfall it, if you know what I mean. Like try to space the cup out a little bit so it can just go down your throat and like, not be on your lips.
Okay. All right, understood.
Other than that, Jamie's gonna go ahead and get your discharge papers ready. And he's also gonna give you our handy dandy lip balm. And you will be all set to go.
Perfect.
Okay, Miss Leilani, here's your aftercare pack. In there, you'll find all of the discharge paperwork, your receipt for your insurance payment, as well as general information on what to watch out for after having lip filler. You will also find, your lip balm, as well as some painkillers just to prevent any sort of pain that might occur.
Okay. Well, thank you. Thank you guys
Thank
again so
you.
much. I love getting procedures with you guys.
I
Thank
know
you
you
for
do.
coming in.
Leilani's like the top customer over in cosmetics. Girl, she's like all Barbied out.
Well, if there's any bleeding, like you said, or if I get an allergic reaction, I will definitely come back within 48 hours.
All right, thank you. All right, Miss Marie,
Yeah.
you're all good.